Hi, everyone. I'm the director for our New Zealand registered not-for-profit Common Knowledge Trust, and I was privileged in the early 1970s to work with hundreds of mothers and fathers and to develop what's called the Birthing Better skills. And we've recently put out 6 new courses, and we've put out a successful Vbac course that I want to talk about, and our new course is the Vbac Birth Coach course. They go together. So the successful VBAC course, when I gave birth in 1970 in the United States, there was a 4.5% cesarean rate. The fact that 95% of us labored, it was food for fodder for the natural birth movement that said, see, women can labor. And in fact, the World Health Organization said the same thing. See, women can labor. We can. 100% of us can labor. And this is what's really important for you to know. Risks were considered to be normal, natural, physiological, and accepted. And the reason that risks were accepted was that the medical profession wasn't sophisticated enough to do very much about it. So when I gave birth, a cesarean was major abdominal surgery done to save a woman's life. So it's very hard to have a VBAC after a classical incision because it cuts through the muscles of your uterus in a way that when your uterus is contracting, it puts it more at risk. And consumers, because I lived through this, we were the ones that demanded changes. We wanted to have a VBAC. We wanted to be awake when we had a cesarean. We wanted our husbands to be with us if we had a cesarean. And we didn't want to be left with an ugly scar. And we were wearing bikinis. And we started to put pressure on the medical community to change how cesareans were done. And they developed the bikini cut. They did not come up with that. We demanded that as consumers. Made it safer for us to VBAC. We could be awake with a spinal or an epidural. Our husbands could be with us during a cesarean. And we could be more successful with less risk to ourselves if we tried to have a trial of labor or vaginal birth after cesarean. So in this course, you are going to learn all of the birthing better skills that are applicable to preventing a cesarean. And if you're having a VBAC, that's what you're trying to do. You're trying to prevent another cesarean. But we went further than that. First of all, we understood that if we labored, if we had a long labor, which was not uncommon when 95% of us labored, that we were more likely to have more interventions. And those interventions were more likely to end up with a safer cesarean now that they could do them safer. So we had to try to prevent or reduce a long first or second stage. And this is where fathers who developed the birthing better skills were so instrumental in developing the body skills. We birth from the inside as women. They see us from the outside. They get it. They're bumping into our belly all the time. They know that we have a big object inside our container, and the mind of the man goes, how do you get the object out? If you can't change the shape of the object, can you open up the container? Yes, you can. So all of the body skills are important for you to do. You need to do the hip lift, create space, the sacral maneuver, keep your sacrum mobile because that's the bone the baby tries to push out if it needs more space. You need to learn to soften the soft tissue inside your pelvis because you don't want to have a delay in the cervical dilation and you don't want your baby to get stuck. You need to prepare your vagina, very important, and deeply. Perineal massage was just this little bit between in the opening. That did do nothing because where your baby gets stuck is once it moves through the cervix, if you fully dilate it, is it gets stuck at the lower part of your sacrum in the back behind your rectum. And then it has to move down, push all of the tissue of your vagina, the back of the rectum, and it has to come under the pubic bone and turn the corner and then open the lower part of the vaginal tube. So you need to work all inside there, and we have an audio for that. So we have an amazing VBAC course. You'll learn to prepare your body, start at 24 weeks, as early as you can. How much time do you have to spend? 5 minutes, 15 minutes every other day? Is this a lot? 5 minutes a day at 32 weeks when you do the internal work, and then you learn the skills to cope and work through the activity of getting to the vaginal part. When we use VBAC, vaginal birth after cesarean, it is a denial of the labor part. 99.99% of cesareans occur in the labor part because women aren't coping and they have these long first and second stages, or something happens. So you want to work through labor and you want to get to the vaginal part. So you want to have prepared your body for the vaginal part, you want to prepare your body for the labor part, and then you want to have the skills to work through the labor part with your partner. All the Birthing Better skills were developed by fathers and mothers based on our human body. We all blink, we all cough, and we can all tighten up your rectum. And the message is don't tighten your rectum anytime during labor or delivery. How do you know you're doing it? Soften around your rectum now, soften behind it. That's how you know. Men can't see it, but they can tell you to remember not to do that. So you want to use these skills, and then you want to work through the hard work of labor to get to the vaginal part of it. Birthing Better families were not unrealistic. There were many of us who were never going to labor for any number of reasons. We didn't care. We were going to prepare our body anyway for birth because we're pregnant so infrequently, and we want to get closer to our baby, we want to get closer to our partner, and our partner wants to get closer to the two of us. So we prepare our body and we learn the skills. And if we want a VBAC, but we have to have a non-laboring cesarean, we just use our skills on the way to the hospital. That's our labor. Well, being prepped, that's our transition during the surgery. That's the birth of our baby. We get pregnant to have a baby, not a type of birth. For those of us who labor and then have a cesarean, we just use the skills when we're being prepped and during the surgery. Many Birthing Better families, for one reason or another, knew that they couldn't give birth vaginally, but they could labor, and many doctors were fine about that. Also, how do doctors deal with you being skilled? Better, because they see you coping and managing. They don't see you out of control. They don't want you to suffer, which is the much larger part of pregnancy and birth, is suffering rather than a risk. So if you don't suffer, if you look in control, if you're managing, coping, and working well with your partner, as long as everything looks good, your birth providers will negotiate. How do we know? Because we have 50 years of experience doing this, and we know that the healthcare profession is there to help. So when we talk about they want to do this, this, and this, some of them are standards of care. They're assessments, monitoring procedures. You're just going to have to deal with those and work around them just like we do. However, if everything looks good, they're fine. They're absolutely fine with continuing to let us go and continue on. Some of us who had VBACs had very long first or second stages, but we coped well. The medical profession was fine, as long as everything was fine, and as long as we were coping well. So get on with the program now. It's time to grow a skilled birthing population. Could we have prevented as many cesareans if we had a skilled birthing population from the 80s onwards? Absolutely. How do we know that? Because families who are skilled birth better. So there you go. So pass this on and start as soon as you can from 24 weeks. If you're 42 weeks pregnant, scan through the course as fast as you can and learn as many skills as you can, because it is better to have some skills than none. So all the best. We know you can do this.